We're going to be talking about the new ways to treat COVID in the future. Yesterday, a group of experts gathered at the White House to talk exactly that, about the state of this pandemic. Dr. Celine Gounder was there. She's a CBS News contributor and editor-at-large at KFF's Kaiser Health News, and joins us to fill us in on what was discussed. But before we think about the new ways, let's talk about the old ways for just a second. Because, Celine, when we first got the vaccine, everybody thought it was a superpower, we don't have to worry. Because that's normally what vaccines do. Then we're told you got to get a second vaccine. Then we're told you got to get a booster. Then we're told you got to get a second booster, and then you still get it. So how do you explain how we're supposed to process this? I think that's part of the vaccine fatigue.
Yeah.
And I think that's part of the frustration.
I think on some level we overpromised what the vaccines could do. I think people thought they would prevent all infections, they would prevent transmission. In fact, most vaccines are not really designed to do that. Most vaccines are designed to prevent severe disease, hospitalization, and death, so preventing you from getting really sick. And so what people have realized is, oh, I'm still getting an infection. Why is this happening despite the vaccination? The key is that they are keeping you out of the hospital, but people didn't really understand what they were supposed to do.
Yeah, I think if we had been told that, then our expectations would be
It was the
different.
messaging.
Yeah, it was the messaging. Because honest to God, when I got it, I thought, I have a superpower, I'm good. All right. So now as we sit here today, we keep hearing about a new vaccine that's coming in the fall. Will that vaccine be the one that just solves all of the COVID problems for us? Or is it just targeted for one type of variant?
So what we're getting in the fall is being updated for the Omicron BA.5 variant. So that's the one that you're seeing across the country right now.
Has.
Exactly. He probably has BA.5. The issue, though, is we know variants continue to emerge. The virus continues to mutate. So we don't know, even by this fall, BA.5 may not be the variant. We may have something else. And we're kind of chasing our tails right now, trying to keep up with the virus. By the time we figure out there's a new variant, develop an updated vaccine, we might already be on to a new variant.
So will it be possible to have one vaccine that covers all the variants, no matter what form they take?
So this is
what will it take to get that?
That's a good question.
Yeah, so that's one of the technologies we were discussing at the White House yesterday in terms of vaccine advancement. It's what we would call, say, a universal coronavirus vaccine. So it's trying to target a part of the virus that doesn't mutate as much. Figuring out what that is and still getting a vaccine that creates a good immune response that protects you is a little bit of a challenge. And it is going to require more resources, just like we had Operation Warp Speed.
Is that what you mean?
It is money. It is money. So just like Operation Warp Speed poured in a ton of money to try to expedite the development of the original coronavirus vaccines, if you want these faster, it's going to cost more money.
But Doctor, going back to Gayle's point, I mean, if we've received the vaccine, then the second one, and then the two boosters, and we're not going to the hospital, and we're not ending up in an ICU or worse.
You're not compromised.
You're not compromised. If I get another vaccine, it's the same thing, right? In other words, I could still be infected, but I wouldn't be sick enough to go to the hospital. So why not just say, most Americans are going to say, well, I'm good.
Yeah.
Because I'm already
healthy.
I'm healthy, I'm getting infected, and it was just a sniffle, and it's doing what it said. But I don't need another vaccine if the results are that I can still be infected.
Get it,
Yeah. We don't know that it's going to continue to be that way, that they will continue to hold up. And we've seen, especially with Delta and then Omicron, we are seeing, especially the elderly right now, ending up a bit more in the hospital, even if they've had, 2-3 doses of vaccine, which is also why we're telling them to get, that fourth dose. And whether we'll continue to see that erosion in the immunity that you get from these vaccines, we don't know yet, but we do anticipate they may have more and more trouble protecting us.
Yeah. Earlier, you mentioned vaccine advancement and technology. You have something sitting in front of you. What is that exactly?
I do. So this is a skin patch. It has tiny microscopic needles, so you can't even see them on here.
Can you feel them?
Can't really even feel them, no.
And that's for a vaccine?
It's for a vaccine. So you have dry vaccine embedded in these micro needles, and then you take it off kind of like you would a Band-Aid, and you stick it on your arm, just like that, and you leave it on for a few days, and it's delivering the vaccine into your skin.
Self-application vaccine?
You could even do that. I mean, theoretically, you could have your doctor mailing you one of these,
That would replace an injection?
Yeah, this would replace an injection.
And when you take a bath, what happens?
Good question. I have not asked them that. I would suspect you probably want to cover it so it doesn't fall off.
Yeah.
But
I'm not sure I trust myself. or trusted technology, to be honest with you.
Right.
I'm just not sure.
Yeah, me too.
Yeah, I mean, it's a pretty new technology. We haven't used it really for other vaccines yet, but I think there's a lot of promise, not just for COVID, but for other vaccines.
Other vaccines.
Yeah.
Okay. Dr. Celine Gounder, thank you so much. You're the best.